Meet Connie, who is confused. Connie is a 40-year-old woman who started menstruating at the age of 11. She is married with 2 twin boys in their 20s and she works for a venture capital firm. She had a progestin IUD placed 4 years ago because she was tired of the daily pill for so many years. A few months ago, she started noticing that she would sweat through her nightwear and became absent-minded when doing routine tasks in and around her home. She heard in one of her lady groups that night sweats and brain fog were signs of menopause, something she didn't know much about, and so Connie started to wonder, am I in menopause? But before we dive into Connie's story, hello, my name is Khadijah. I am a licensed pharmacist and my focus is on delivering science-based health insights with a specialized emphasis on women's health. I personally adopt a holistic approach prioritizing nutrition and physical activity while also recognizing the potential benefits of herbal medicines, supplements, and pharmaceutical interventions when necessary to support women's well-being. If you're seeking informed guidance in this realm, I invite you to subscribe for tailored information and updates. Now, back to Connie. A common inquiry among women as they age is distinguishing between being menopausal and being in menopause. While the term menopause is often used broadly to encompass hormonal changes in women in their 40s, 50s, 60s, it's crucial to clarify an important distinction. So according to sources such as the National Institutes of Health, the World Health Organization, scientific peer-reviewed literature, and expert groups like the Menopause Society, menopause is officially defined as the permanent cessation of menstruation and ovulation resulting from ovarian failure, typically occurring around the age of 51 years. This is deemed natural or spontaneous after 12 consecutive months of amenorrhea or no period and absence of any pathological causes. Menopause may, however, be induced prematurely before the age of 40 or early before the age of 45 due to medical interventions such as surgery, removal of a woman's ovaries from conditions like ovarian cancer, or as a consequence of treatments like chemotherapy or radiation therapy. In the United States, an estimated 2 million women enter menopause each year, while globally this number reaches 47 million. Nevertheless, these facts alone may not entirely address Connie's question. For more comprehensive guidance, it's crucial to explore what is commonly observed in women at or around her age. So, according to the Menopause Society, when a woman suspects she may be perimenopausal, it is recommended to undergo a thorough medical examination by a qualified health professional. This can be challenging as, not all physicians, including obstetricians and gynecologists or OBGYNs, have extensive training in menopause. This issue has gained increased attention in recent years, and so changes in practice have been seen. The diagnosis of perimenopause typically involves reviewing a woman's medical history, menstrual record, and her presenting signs and symptoms. The most common symptoms women in their 40s experience often involve changes in menstrual patterns and the onset of hot flashes. Adjusting Connie's menstrual cycle can be somewhat complex since she hasn't had a period in the past couple of years due to her IUD placement. It's crucial to note that women with Connie's type of IUD may experience light to no bleeding at all. So is there a test for perimenopause or menopause? The Menopause Society doesn't recommend testing women like Connie, even if she believes she is in perimenopause. For women, hormone levels are rarely stable and undergo constant fluctuations throughout the menstrual cycle. It's worth noting that while some medical providers may opt to test for other conditions that can mimic perimenopausal symptoms, such as thyroid disease, it is not universally recommended. What about saliva testing? Typically, salivary hormone level tests are expensive and are unfortunately not very accurate. Therefore, this is not recommended to evaluate or treat menopausal symptoms. What about follicle stimulating hormone testing? Some medical providers may measure follicle-stimulating hormone or FSH levels to confirm menopause. When a woman's FSH blood level is consistently elevated to 30 milli-international units per milliliter or higher, and she has not had a menstrual period for a year, it is generally accepted that she has reached menopause. However, menopause experts caution that a single FSH level can be misleading in perimenopause due to fluctuating estrogen production. It is found that both estrogen and FSH levels can vary greatly during this phase. Therefore, one elevated FSH level is not sufficient to confirm menopause. Furthermore, a low FSH level in a woman experiencing hot flashes and irregular periods does not rule out perimenopause. Additionally, if a woman is using certain hormone therapies, an FSH test may not be valid. Thus, for someone like Connie, it is unlikely that she would undergo this test due to her IUD placement. However, individual practitioners may have different approaches and may request multiple tests within a specific time frame. As far as over-the-counter urine tests for menopause, the results have been mixed, and I am working on a review of all the menopausal test kits available at your local pharmacy. So, is Connie in menopause? If you consider all of the facts we know about Connie, including her age and her symptoms, then she should consider herself as actively in the menopause transition. Now, this does not mean she should remain confused with this information. While she should consult her provider, Connie should also assess her lifestyle and nutrition, her eating habits, and so forth, and if they are beneficial for her health and managing her symptoms at this point in her life. Watch this video to learn more about the 4 main areas that you and Connie, as perimenopausal women, should start to take seriously if you haven't already. Thank you for watching, and see you in the next video.